What if I told you that your penis could be getting smaller right now, and you wouldn't feel a single warning sign? No pain, no sudden change, no dramatic moment that tells you something is wrong. Just a slow, silent process happening in the background, day after day, until one morning you realize things are not the way they used to be. And by then, part of that loss may already be permanent. This isn't about environmental chemicals or some rare toxin. It's not about a strange condition you've never heard of. It's about 6 daily habits that millions of men repeat without thinking. Habits that quietly damage blood vessels, weaken erectile tissue, and trigger structural changes that can make the penis physically smaller over time. Here's what makes this serious. The damage does not announce itself. There is no alarm. Research shows that up to 70% of men who undergo certain medical treatments report measurable penile shrinkage ranging from 1/2 inch to 3/4 of an inch. Studies tracking men with high body mass index have found a direct relationship between weight gain and a reduction in erect penile length. In an analysis of 274 patients who underwent penile measurements, older men with atherosclerosis, the hardening of arteries, showed greater penile atrophy. As arteries stiffen and narrow, collagen changes inside the penis make erections more difficult and contribute to size reduction. A 2021 Italian study examining thousands of men found that smokers were significantly more likely to have below-average penile circumference. And one of the most alarming findings in urology research is this. Men who go 3 to 6 months without regular erections can lose 1 to 2 centimeters of length. That is up to 3/4 of an inch. Permanently. Today, you're going to understand exactly why that happens. We're going to break down the 6 daily habits responsible for this damage, the biological mechanisms that destroy healthy penile tissue, and what you must stop doing if you want to protect your size and function. I'm Dr. Mika Hayashi, a urologist with more than a decade of experience helping men preserve erectile function, protect penile structure, and prevent long-term tissue damage. The habits I am about to describe are not rare, they are not extreme. They are part of normal modern life. And that is precisely why they are so dangerous. Before we get into them, you need to understand what actually causes permanent shrinkage at the tissue level. Without that foundation, none of this will fully make sense. Your penis contains 3 cylindrical chambers. 2 larger chambers, called the corpora cavernosa, run along the top and sides. A smaller chamber, the corpus spongiosum, surrounds the urethra and forms the head. These chambers are made of specialized erectile tissue composed of smooth muscle cells, collagen fibers, and an intricate network of blood vessels. When you are aroused, blood flows rapidly into these chambers. The smooth muscle relaxes, the tissue expands, and an erection occurs. Permanent shrinkage happens when that system is damaged. There are 3 primary mechanisms behind it. The first is smooth muscle cell death and fibrosis. When erectile tissue does not receive regular oxygen-rich blood flow, smooth muscle cells begin to die through a process known as apoptosis, or programmed cell death. Research consistently shows that erectile dysfunction is associated with a loss of smooth muscle and an increase in fibrosis within the corpora cavernosa. Dead smooth muscle cells do not regenerate. Instead, they are replaced with dense fibrous scar tissue made mainly of collagen types I, III, and IV. Studies have demonstrated that transforming growth factor beta, 1, a powerful pro-fibrotic growth factor, increases collagen production in human corpus cavernosum's smooth muscle cells, particularly under low oxygen conditions. Here is how the cycle works. When tissue becomes hypoxic, meaning deprived of oxygen, it increases expression of transforming growth factor beta, 1. This stimulates collagen production, while simultaneously reducing prostaglandin E synthesis, a compound that normally limits excessive collagen formation. The result is a self-perpetuating loop. Low oxygen triggers fibrosis, and fibrosis further restricts blood flow, which creates even more oxygen deprivation. Fibrous scar tissue does not stretch like healthy, smooth muscle. It is stiff, inelastic, and structurally shorter. In animal studies where cavernous nerves were injured, researchers observed that the smooth muscle-to-collagen ratio dropped significantly within days. Smooth muscle cell death peaked around day 3, and by 30 to 45 days, fibrosis had advanced dramatically. Once excessive collagen accumulates and myofibroblasts persist, the structural changes become extremely difficult to reverse. The second mechanism is vascular damage and atherosclerosis. The arteries supplying the penis, known as cavernosal arteries, are small and delicate, even narrower than coronary arteries in the heart. When these vessels are exposed to oxidative stress, inflammation, high cholesterol, or chronic high blood pressure, they gradually narrow and stiffen. Atherosclerosis in the penile arteries leads to reduced oxygen tension in erectile tissue. As smooth muscle cells decline with aging and vascular disease, collagen deposits increase, leading to corporal fibrosis. These changes also affect the muscular walls of the arteries themselves. Increased oxidative stress stimulates apoptosis in smooth muscle cells and promotes collagen deposition both in erectile chambers and arterial walls. When blood vessels become rigid and constricted, they cannot deliver enough blood for a full erection. In diabetes models, researchers have observed marked increases in vascular smooth muscle apoptosis, dramatic decreases in smooth muscle content, and significant fibrosis. This creates both inflow problems due to narrowed arteries and outflow problems due to stiffened erectile tissue. The third mechanism involves collagen restructuring and loss of tissue compliance. Healthy penile tissue contains organized collagen that provides support while maintaining flexibility. Types I, III, and IV collagen form a balanced framework, and endothelial cells secrete type IV collagen to maintain vessel integrity. When injury, hypoxia, or chronic inflammation occurs, the body lays down new collagen in a dense, disorganized pattern. This process, known as fibrosis, alters the mechanical properties of the tissue. In conditions like Peyronie's disease, myofibroblasts produce excessive type III collagen, creating rigid plaques and shortening the penis. Normally, during healing, excess collagen is broken down by enzymes called matrix metalloproteinases, and myofibroblasts undergo apoptosis. But when this process fails, these collagen-producing cells persist and continue laying down stiff extracellular matrix. The tissue becomes shorter, less elastic, and unable to fully expand even when blood flow is adequate. Now that you understand the biological foundation, we can begin with the first daily habit that quietly triggers this destructive cascade. The first habit is chronic sleep deprivation, and for many men, this is the most underestimated threat to penile health. Most people think sleep is about energy, mood, or productivity. Very few realize that while you sleep, your body is actively protecting the structural integrity of your erectile tissue. During deep sleep, especially during REM cycles, healthy men experience 3 to 5 spontaneous erections each night. These episodes typically last between 20 and 40 minutes. They are not caused by sexual dreams. They are not random. They are a built-in biological maintenance system. Those nocturnal erections flood the corpora cavernosa with oxygen-rich blood. That oxygen keeps smooth muscle cells alive, nourished, and functional. It prevents hypoxia. It prevents activation of profibrotic pathways. It protects against the exact mechanisms we just discussed. When you consistently sleep fewer than 6 hours per night, you reduce REM sleep. When REM sleep is shortened or fragmented, nocturnal erections decrease in both frequency and duration. Over weeks and months, that reduced oxygenation begins to matter. Smooth muscle cells start dying through apoptosis. Collagen begins replacing healthy tissue. Myofibroblasts accumulate and produce even more fibrous material. At the molecular level, hypoxia increases transforming growth factor beta, 1 expression. That activates the SMAD signaling pathway, which drives fibrosis. Collagen production rises, while protective antifibrotic signals decline. Research in cavernous nerve injury models has shown that blocking the transforming growth factor beta, one pathway improves erectile recovery and preserves the microarchitecture of the corpus cavernosum. In other words, when fibrosis is prevented, tissue integrity remains intact. Now imagine the opposite: months of reduced nocturnal erections, chronic oxygen deprivation, continuous activation of fibrotic signaling. Over time, the smooth muscle to collagen ratio shifts, tissue compliance drops, length can decrease. One landmark observation in urology found that men who go 3 to 6 months without regular erections may lose 1 to 2 centimeters of length. When chronic sleep deprivation disrupts nighttime erections, you are slowly recreating that same environment of tissue atrophy and fibrotic replacement. The solution is not complicated, but it requires discipline. Aim for 7 to 9 hours of consistent, high-quality sleep each night. Protect your sleep schedule, the same way you protect your diet or your career. If you snore loudly, wake up gasping, feel exhausted despite spending enough time in bed, or suspect sleep apnea, get evaluated. Obstructive sleep apnea blocks REM sleep and reduces oxygen levels systemically, including in penile tissue. Treatment with CPAP has been shown to restore oxygenation and improve erectile function. The second habit is living a sedentary lifestyle without regular physical activity. Modern life makes this easy. Hours sitting at a desk, driving instead of walking, minimal movement outside of work. But your vascular system was never designed for constant inactivity. Erections depend on nitric oxide. Nitric oxide is the signaling molecule that relaxes smooth muscle and allows blood vessels to dilate. Cardiovascular exercise stimulates nitric oxide production. When you stop moving, nitric oxide levels decline. Blood vessels become less responsive. Circulation weakens. Physical inactivity also promotes visceral fat accumulation. Visceral fat is not just stored energy. It is metabolically active tissue that releases inflammatory cytokines and disrupts hormonal balance. As visceral fat increases, testosterone levels often decline while inflammatory markers rise. Both negatively affect erectile function. At the same time, a sedentary lifestyle accelerates atherosclerosis. Cholesterol and fatty deposits accumulate along arterial walls. The cavernosal arteries, being smaller than coronary arteries, are often affected earlier. Reduced diameter means reduced blood inflow. Less inflow means less oxygen. Less oxygen means activation of fibrosis pathways. Studies consistently show that men who engage in regular aerobic exercise maintain better erectile function compared to sedentary men. Exercise improves endothelial function, enhances nitric oxide production, reduces inflammation, and preserves smooth muscle integrity. The recommendation is straightforward. Engage in at least 30 minutes of moderate cardiovascular exercise 5 days per week. Walking briskly, cycling, swimming, jogging, anything that elevates your heart rate and improves circulation. Add resistance training twice weekly to build muscle mass, which naturally supports testosterone production and metabolic health. The intensity does not have to be extreme. Consistency matters more than intensity. The third habit is consuming a diet high in processed foods and refined sugar. Every meal influences vascular health. Diets rich in refined carbohydrates and added sugars cause repeated spikes in blood glucose and insulin. Over time, this leads to endothelial dysfunction. The endothelium is the inner lining of blood vessels. When endothelial cells are damaged, nitric oxide production drops. Inflammation increases. Collagen deposition in vessel walls accelerates. Arteries gradually stiffen and narrow. High sugar intake also increases formation of advanced glycation end products, known as AGEs. These compounds bind to proteins and alter their structure, accelerating tissue aging and stiffness. In erectile tissue, ages impair elasticity and promote fibrosis. The 2021 Italian research, linking high BMI with reduced erect penile length, underscores this point. Weight gain does not only bury the visible shaft, it also directly damages the internal vascular and structural integrity of penile tissue. An anti-inflammatory whole food diet protects vascular health. Leafy greens provide dietary nitrates that convert to nitric oxide. Berries deliver antioxidants that neutralize oxidative stress. Fatty fish supply omega-3 fatty acids that reduce inflammation. Limiting processed foods, refined sugars, and trans fats reduces endothelial injury and slows fibrotic progression. Think of diet as long-term structural maintenance. Every poor dietary choice increases vascular strain. Every nutrient-dense meal supports endothelial resilience. Now we move to the fourth habit. And this one often surprises men because it involves medications prescribed for entirely different reasons. Certain drugs can gradually impair erectile function and potentially contribute to tissue atrophy without patients being clearly warned. Some medications used for hair loss inhibit 5-alpha reductase, reducing conversion of testosterone to dihydrotestosterone, or DHT. While lowering DHT may slow hair loss, DHT plays a role in maintaining penile tissue health. Chronic suppression in susceptible individuals has been associated with sexual side effects, including decreased erectile rigidity and, in some reports, perceived shrinkage. Selective serotonin reuptake inhibitors, commonly prescribed for depression and anxiety, can reduce sexual desire and alter vascular responsiveness. According to data reviewed by institutions such as Harvard Medical School, these medications may affect erection quality by altering blood vessel reactivity over time. Certain blood pressure medications may also reduce systemic blood flow. While controlling hypertension is essential, reduced perfusion to penile tissue over extended periods can contribute to smooth muscle atrophy if not properly managed. This does not mean you should stop necessary medications. It means you should have informed discussions with your physician. Ask specifically about sexual side effects. Ask whether alternatives exist. In many cases, equally effective medications are available with fewer sexual consequences. Never discontinue treatment without medical supervision, but do not ignore changes in erectile function either. The fifth habit involves neglecting chronic medical conditions that require control and monitoring. When diseases like diabetes or hypertension are left unmanaged, the structural damage to penile tissue accelerates. And that is where we continue. When chronic medical conditions are ignored or poorly controlled, the damage does not stay limited to blood sugar readings or blood pressure numbers on a chart. It extends deep into vascular structures, nerve pathways, and the microscopic architecture of erectile tissue. Over time, that damage can translate into measurable, permanent loss of length and function. Let's start with poorly controlled diabetes, one of the most destructive conditions for penile health. Chronic elevation of blood glucose triggers a cascade of harmful effects at the cellular level. High blood sugar damages the endothelium, the delicate inner lining of blood vessels responsible for nitric oxide production. Without sufficient nitric oxide, arteries cannot dilate properly. Reduced dilation means restricted blood flow into the corpora cavernosa, but the damage does not stop there. Diabetes also injures nerves through a process known as diabetic neuropathy. The nerves that regulate blood flow and coordinate the complex sequence of events required for an erection become impaired. When neural signaling weakens, erectile quality declines, and tissue oxygenation becomes inconsistent. Most critically, diabetes accelerates fibrosis inside penile tissue. Research examining the corpus cavernosum of diabetic patients and animal models consistently shows increased apoptosis of vascular smooth muscle cells, decreased smooth muscle content, and dramatic increases in collagen deposition. In simple terms, healthy, flexible muscle is replaced with stiff scar tissue. At the molecular level, diabetes activates the transforming growth factor beta, one SMAD signaling pathway, the same profibrotic pathway we discussed earlier. This pathway stimulates excessive collagen synthesis and promotes structural remodeling of erectile tissue. Reactive oxygen species, which are elevated in diabetes, further drive smooth muscle cell death and inflammatory signaling. Over time, the smooth muscle to collagen ratio shifts significantly. The corpora cavernosa accumulate dense collagen fibers. Simultaneously, similar histological changes occur within the penile arteries themselves. This means both the tissue and the vessels feeding it are undergoing fibrotic transformation. Blood inflow decreases while tissue compliance declines. Even if partial blood flow remains, the tissue may no longer expand fully. Studies in type 2 diabetes models reveal that smooth muscle loss and increased apoptosis occur not only in erectile tissue, but also in penile dorsal arteries and even the aorta. This indicates systemic vascular damage. However, because penile arteries are smaller and more delicate, they often show dysfunction earlier than larger vessels. The longer diabetes remains uncontrolled, the more irreversible the changes become. Fibrosis advances quietly. Length may gradually decrease. Erectile rigidity weakens. By the time symptoms are obvious, structural remodeling has often been underway for years. Uncontrolled hypertension produces a similar pattern of injury. Chronic high blood pressure subjects the vascular endothelium to constant mechanical stress. Over time, this leads to endothelial dysfunction, reduced nitric oxide availability, and thickening of arterial walls. In penile arteries, this narrowing directly limits blood inflow during arousal. Hypertension also promotes oxidative stress and inflammatory signaling, which stimulate collagen deposition within vascular walls. As arteries stiffen, their ability to respond dynamically to sexual stimulation declines. Reduced responsiveness translates to weaker erections and lower oxygen delivery. Again, hypoxia feeds fibrosis. Sleep apnea is another condition many men dismiss. Obstructive sleep apnea repeatedly interrupts breathing during sleep, reducing systemic oxygen levels and fragmenting REM cycles. Without sustained REM sleep, nocturnal erections diminish. Without those regular oxygen-rich episodes, smooth muscle cells become vulnerable to apoptosis. Chronic oxygen deprivation accelerates fibrotic remodeling. Men with untreated sleep apnea frequently report worsening erectile function over time. The mechanism is not mysterious. Reduced oxygenation plus fragmented REM equals reduced tissue maintenance. Add systemic inflammation triggered by sleep apnea, and the structural risk increases further. The solution for chronic conditions is disciplined management. For diabetes, maintaining hemoglobin A1C below 7% significantly reduces microvascular damage. Consistent blood sugar monitoring, dietary control, exercise, and appropriate medication are not optional if you want to preserve tissue integrity. For hypertension, keeping blood pressure consistently below 130/80 protects delicate penile arteries. Lifestyle modification combined with appropriate pharmacologic therapy can prevent progressive vascular narrowing. If sleep apnea is suspected, evaluation through a sleep study is critical. Treatment with CPAP restores oxygen levels during sleep, supports REM cycles, and helps preserve nocturnal erections. Addressing apnea is not just about feeling rested. It is about protecting vascular and erectile health at the cellular level. Now we move to the sixth daily habit, allowing excessive weight gain, particularly abdominal fat accumulation. Many men underestimate how deeply weight affects penile structure. There are two components to this issue: visible reduction and structural damage. First, as fat accumulates in the lower abdomen and suprapubic region, it creates a fat pad that partially buries the base of the penis. The shaft itself may not initially change length, but less of it becomes externally visible. Some men lose up to 1 inch of visible length due to suprapubic fat alone. This is not an illusion. It is a physical concealment effect. However, the second component is more concerning. Excess body fat alters hormonal balance. Adipose tissue contains aromatase, an enzyme that converts testosterone into estrogen. As abdominal fat increases, aromatase activity rises. Testosterone levels may decline while estrogen levels increase. Testosterone plays a role in maintaining smooth muscle content and structural integrity within erectile tissue. Lower levels can contribute to atrophy over time. Visceral fat is also metabolically active and pro-inflammatory. It releases cytokines that promote systemic inflammation and oxidative stress. These inflammatory signals damage endothelial cells, impair nitric oxide production, and accelerate fibrosis. In addition, obesity is strongly associated with insulin resistance, type 2 diabetes, hypertension, and dyslipidemia. Each of these independently contributes to vascular injury and smooth muscle loss. The 2021 findings linking high BMI with reduced erect penile length reinforce that weight is not merely a cosmetic issue. Increased body mass correlates with measurable structural change. When obesity coexists with sedentary behavior, poor diet, and sleep disruption, the combined impact becomes amplified. Reduced nitric oxide production, chronic inflammation, hormonal imbalance, and vascular narrowing converge on the same endpoint. Decreased oxygen delivery and increased fibrotic remodeling. The encouraging part is that weight reduction can partially reverse some early changes. Studies show that significant weight loss improves erectile function scores and vascular responsiveness. Reducing abdominal fat decreases aromatase activity, helps normalize testosterone levels, lowers inflammatory cytokines, and improves endothelial performance. However, advanced fibrosis does not easily reverse. Once collagen has replaced large portions of smooth muscle and structural shortening has occurred, full recovery becomes unlikely. This is why early intervention matters. Across all 6 habits, a consistent pattern emerges. Reduced oxygenation, increased inflammation, hormonal imbalance, and vascular injury activate pro-fibrotic pathways. Transforming growth factor beta 1 rises. Smooth muscle cells undergo apoptosis. Collagen accumulates. Tissue compliance declines. Length decreases. None of this happens overnight. It unfolds gradually. Months turn into years. Because there is no immediate pain, many men ignore subtle changes in erectile firmness or frequency. But at the microscopic level, structural remodeling may already be advancing. Understanding these mechanisms gives you control. You cannot change aging, but you can dramatically influence how your tissue responds to it. And that is where prevention becomes not just possible, but powerful. In the next section, we will bring all of this together into a clear, practical prevention strategy grounded in the biology we have just examined.